everyone. Thanks for watching my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. In the past week, we've had some good news and some not so good news. Across the U.S., cases, hospitalizations, and deaths continue to fall. As of last Thursday, 94% of Americans lived in a county that is considered low or medium risk and where masks are therefore not recommended for all by the CDC. But some countries like Hong Kong, New Zealand, Singapore, and South Korea are still really in the thick of their Omicron surge, setting records for cases and hospitalizations like the US did in January. In Europe, there's a concerning picture. Several countries are experiencing a U-turn. The case drop that looked like ours has now turned around and is going back up. I'll talk more about that in a minute. Meanwhile, in the US, over a third of wastewater surveillance sites are seeing an increase in viral levels. We will need to watch all of this very closely. Our first question is from Cordelia from Braintree. I'm having anxiety about news that several countries in Europe have seen an uptick in COVID-19 cases in the past week or so. What is causing this? How concerned should we be about this happening in the US? Is there another variant to worry about? I must admit, I'm having anxiety too. I think it's almost all due to BA.2, the subvariant of Omicron, which is somewhat more contagious than BA.1. Certainly, there are no reports that suggest that a new variant is at play. And because Omicron infection confers immunity to BA.2, I don't think we're likely to see anything as bad as the Omicron surge be caused by BA.2. In fact, we know that in South Africa, where BA.2 has become predominant, cases didn't rise at all. So that's not inevitable. So I think we could see some slowing of our descent or an uptick in a few weeks or so, and we have to prepare. That means vaccinating and boosting, making sure we can scale up testing and treatments, planning to flex hospital capacity, and in the meantime, we can enjoy the low case numbers now, knowing we have wastewater surveillance with the levels being early indicators of a problem here in Massachusetts, but that's not happening yet. Our second question was sent in by Noreen from Melrose. I read that the CEO of Pfizer thinks a fourth COVID-19 shot will be needed. What are your thoughts on the timing of yet another booster? Well, first, we should not take our health advice from a person who stands to make tons of money off of a certain outcome. That being said, the CEO of Pfizer is sitting on lots of data that I don't have. I know that a study I read out of Israel was pretty unimpressive in terms of effectiveness at preventing infection compared to 3 doses, like 30% for Pfizer and 11% for Moderna. But a Tuesday press release suggests the company has real-world data that shows effectiveness for people over 60 years of age. In my opinion, any decision about the need for a fourth dose is entirely dependent on a key question, which keeps coming up but hasn't been answered in a while, and that is, what is the goal of the U.S. vaccination program? Are we trying to prevent all infections, or are we trying to prevent severe disease, hospitalization, and death? That question was asked months ago at a meeting of the External Advisory Committee to the FDA. And at that time, Peter Marks, who heads the vaccine division of FDA, said that the goal was still to try to prevent infections, if possible, and thus transmission. But that was before Omicron, and before we knew how quickly antibodies wane and thus protection against all infection. Many experts feel that goal is no longer reasonable. So if U.S. officials decide that the goal of vaccination is to prevent severe disease, then I suspect that a fourth dose might be recommended, but only for a select subsegment of the population. Our last question is from Marcelo from Stowe. Last week it was announced that Massachusetts had significantly overcounted COVID deaths. Yet most things I have read indicate that pandemic deaths have been substantially undercounted worldwide. Has the pandemic actually been more or less severe than reported? And how do these changes in Massachusetts help make recording this sad statistic more accurate? The thing is, it's extremely difficult to ascertain the cause of death. What goes on the death certificate is often just a guess, often made in the middle of the night by someone who might not even know the patient very well. If someone dies in the hospital after a car accident, but tests positive for COVID, how do we know whether COVID played a role? If someone has a stroke, is that due to COVID, which we know affects blood clotting, or is it due to that person's underlying medical conditions, or both? What about the patient who's critically ill in the ICU from COVID and then has complication after complication from being sick and debilitated and dies 4 months later having never left the hospital? Do we count that as a COVID death? We're likely overcounting many deaths and undercounting many deaths, and there's no good solution except to try to standardize as well as possible the way we do it, so every state is counting them the same way. And that's what the new definition is trying to do. That's all the time we have for this week. You can send me your questions about the rollback of COVID restrictions, how spikes elsewhere may impact us in the weeks to come, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.